Nigeria's public healthcare system faces imminent collapse as medical professionals escalate their demands for improved welfare. Doctors under the Nigerian Medical Association (NMA) have issued a 21-day ultimatum to the federal government, threatening a total and indefinite nationwide strike if demands are not met. Meanwhile, the National Association of Nigerian Nurses and Midwives (NNM), began a 7-day warning strike yesterday, impacting federal hospitals nationwide. Ultimatum stemmed from a July 26, 2025 emergency delegates meeting in Abuja. Doctors expressed deep disappointment over stalled negotiations regarding their welfare, particularly the disputed Consolidated Medical Salary Scale (CONMES) circular. The NMA insists the circular, which impacts their salaries, must be withdrawn and not suspended. Additional grievances include delayed payment of 7-month arrears from a CONMES adjustment and the government general neglect of the health sector. The NMA president, Professor Bala Odo, and Secretary General Dr. Jamin Yegbo signed a communique condemning the government's stance. The NMA warns of impending industrial disharmony if demands are not comprehensively addressed by July 27, 2025. NANNM warning strike commenced yesterday at midnight following the expiration of a 15-day ultimatum. This action affects all nursing services in federal health institutions, including teaching hospitals and federal medical centers. NANNM National Secretary Comrade Enya Osinachi directed all units to withdraw services immediately, ensuring no skeletal nursing services. NANMA National Chairman Comrade Morakinyo Reawan previously criticized recent allowances review as insufficient. Nurses demand the Department of Nursing at the Federal Ministry of Health increased shift duties and specialist allowance, safe work environments, and well-equipped hospitals to curb medical tourism. We are talking about the brain drain in the health sector. Many nurses, many doctors are leaving Nigeria to other civilized nations to lend their skills, to earn their wages, and think of how they can have better lives. The ones over here are not being paid. What are your thoughts on this report?
This brings us to what I've been saying earlier before this time. And in the Nigerian sector, the Senate should come up with a policy that all public servants, I've said this severally and I'll keep saying it, all public servants, whether from the presidency down to the ministers, the commissioners, House of Reps, House of Members, all of them, their medical, from them to their children, to all their generations, should school in Nigeria, the medical checkup, everything should be in Nigeria. That's when we can have a better health sector. Because if without this, we have a pluralized system, we have a very porous system. If we don't bring to play, because I believe when it comes to basic amenities, it is what it is food, shelter, and health. So if the persons who are combating illness, sicknesses are being regarded as nothing to do without that just mere person, then the system, because if you look at from the government prestataries, there's none of them that is being paid the same way they're paying this same person. So this aspect of the government of the day allowing these persons to go on strike. They're going on strike because they know that they don't get their basic amenities, their health within the country. So on that note, anything can happen. The system can go on shambles. So,
but the government needs the people to be a government.
Yes, but the government of the day does not care about. Yes, the government of the day in Nigeria does not care about the masses. They don't see the masses as anything. They see the masses as people that should go poorer, that should go down. Because if not, how can the government of the day keep borrowing some trillions and the livelihood and the system of Nigeria keeps going down, keeps depreciating? we have instead of we having deflation on daily basis.
I want to ask you, Mr. Akarika, do you think that this medical personnel, they are not being paid? Because at Lagos, in Lagos State, the NMA complained that their July salary, their April salary at first was slashed. After negotiations, it was the balance was now paid, and in July it was equally slashed, and a communique was sent around to say, okay, this is why we're slashing, even though there had been prior agreements. Now, when this is done, do you feel that, now you have said the pain point of the citizenry is not being looked into by the government, right? Do you think that this idea of this constant slash is because the government cannot afford the demand that they have agreed with the doctors on?
Okay, Otara, I want to also ask, how many billions are these persons demanding per person? Now, even the Bible says the worker is worthy of his wages. He that has worked, let him eat. So, for someone who has been unleashing his potentials in the health sector, and the person maybe is asking for an increment, or maybe is asking for what he or she has worked for. Not the person is not asking for wardrobe allowance, as most of them do in the government. Maybe they have wardrobe allowance, maybe they have scholarships, they share the scholarships and all that. This same person, they're not asking for this, they're asking for, I have worked for this, give this to me. And as time goes on, let there be a little increment on this to be able to what to settle the hardship that is coming up. Is it a crime? Is it something that the government can look into? I'm disappointed with the government of the day. The government of the day is not really helping us.
Now,
so this week, there are some things that shouldn't. There are some things in the Western world we don't really think of this. That is why you see Nigerians are going outside the country for solace, because they feel that now, okay, because most of the doctors and nurses are from Nigerians. They go there to become the best. They have the best brains, the best hands. That should work on the Nigerian economy. That should work on the health sector of Nigeria. Yet the government total refusal to pay these persons. So what do you expect from them?
Now, what do you think the fate of nurses? They have gone on strike. The nurses are now on strike. What will be the fate of common Nigerians that are currently in federal university teaching hospitals and FMCs? What would your fate be in the next 2 weeks?
Otara, based on the persistency in the system going forward, there's no way forward for this, because there's some level of disillusionment in the system, whereby what you're working for, you're not seeing. That's why we go to the immigration sector. Almost everybody wants to leave the country, wants to leave the shores of the country. Just as JJ has affirmed, you see, by the day everybody wants to leave the country. Why not? And my concern is that the persons in the arm of affairs should see how they can. Nigeria should come back to its 10 days. Should come back to harmony. So the health sector, for now, there's no incoming and technical know-how in the system. The Nigerian you see even some persons in the some government agencies, when once they have some issues, they travel abroad. So these are not things that should be. So they should look inwards and see how the health sector of Nigeria can be proactive.
All right.